Hi, my name is Brianna Pocknell, and I chose to do my presentation on birth tourism, navigating ethical, legal, and healthcare controversies. Birth tourism, defined as traveling to another country to give birth, is a growing trend that sparks debate worldwide. It provides families with citizenship opportunities and potential benefits for their children. It also draws criticism for overburdening healthcare systems and raising legal concerns. Rooted in both opportunity and controversy, birth tourism is a complex issue that raises debates over its ethical implications, legal challenges, and impact on healthcare systems. So, what is birth tourism? Birth tourism refers to traveling to another country with the specific intention of giving birth to secure citizenship for the child. Jacob defines it as, quote, a practice where individuals intentionally exploit birthright citizenship policies for personal gain, end quote. Countries like the United States and Canada, where birthright citizenship is guaranteed, have become hotspots for this practice. While advocates may argue it provides opportunities for families, critics highlight the exploitation of legal loopholes and the ethical dilemmas it presents. So a lot of people travel to the United States, Canada, and Brazil to seek better access for education, healthcare, and future opportunities for their children. This chart that I have kind of highlights in blue where birthright citizenship is most popular. And as you can see in Europe over there, it's not very popular. So that means a lot of people from there travel to North and South America to get those birthright citizenships. To better understand birth tourism, it's important to examine its historical background. Birth tourism became significant in the United States due to the 14th Amendment, which guarantees citizenship to anyone born on U.S. soil. According to Jacob, this policy was originally intended to promote equality, but has increasingly been used for personal gain. The practice has grown popular among Chinese and Russian families, as Shea Young notes, people who view it as a way to secure citizenship and future opportunities for their children. So furthermore, the globalization of travel and increasing economic inequality have contributed to the rise of birth tourism. Over time, this demand has led to the development of specialized maternity hotels in destinations like California and British Columbia, creating infrastructure specifically catering to birth tourism. One of the primary criticisms of birth tourism is the strain it places on healthcare systems. As Shea Young points out, maternity hospitals in areas like California often experience overcrowding due to birth tourists, which can lead to fewer resources and longer wait times for local residents. This issue is compounded by the fact that some birth tourists fail to pay their medical bills, leaving hospitals to absorb those costs. Additionally, Jacob highlights that birth tourism creates, quote, a financial burden of public healthcare systems, especially with limited resources. These strains demonstrate how the practice negatively impacts local communities. Proponents of birth tourism argue that it provides economic benefits, as families often pay high fees for medical care, accommodations, and legal services. Jacob notes that in some cases, birth tourism, quote, contributes to local economies, particularly in regions with specialized facilities, end quote. Supporters also claim that dual citizenship offers children better educational opportunities, giving them a more promising future. While these arguments may seem compelling, they overlook the broader consequences of birth tourism. Colger emphasizes that, quote, the exploitation of citizenship law undermines the principles of equality and fairness in immigration systems, end quote. Moreover, the economic contributions from birth tourism are often outweighed by the strain it places on public resources, as hospitals and governments are left to address the increased demand for services. A more balanced approach would involve tightening visa regulations and implementing stricter enforcement to ensure that the system is not being abused. Instances for unethical behavior associated with birth tourism further demonstrate the need for stricter regulations. Young highlights cases where families have engaged in visa fraud or provided false declarations to gain entry into countries for birth tourism purposes. These actions not only undermine immigration policies, but also erode public trust in the system. Additionally, Jacob reports that, quote, an estimated 30,000 births annually in the United States are attributed to birth tourism, a significant number reflecting the scale of the issue and its potential to disrupt local systems. So this chart is actually from British Columbia of rising birth tourism. In 2019, it kind of is at a peak, and then it drops down in 2020 and 2021 due to COVID and travel restrictions. It fluctuates back upwards in 2022 as the travel restrictions are lifted. In conclusion, while birth tourism may appear to offer opportunities for families, its negative impacts on healthcare systems, immigration laws, and public resources cannot be ignored. The practice exploits legal loopholes, undermines fairness of citizenship policies, and places unnecessary strain on local communities. As Carl Colger argues, quote, balanced yet firm policies are essential to protect the integrity of immigration systems while ensuring resources are preserved for those who truly need them, end quote. By addressing the root causes of birth tourism through stricter regulations and enforcement, we can protect the fairness and sustainability of our systems while discouraging unethical practices.